CBD is generally considered safe and non-addictive. It's thought to be non-toxic, not to have any effect on food intake or appetite. It doesn't seem to affect heart rate or blood pressure. And although it has, as we discussed, no specific psychotropic or kind of mind-altering effects, I have had a few patients report that they feel a little bit altered after first taking CBD. One patient did describe feeling somewhat high. Another patient described feeling as if she'd had like a glass of wine and felt a little bit kind of tipsy or relaxed. So until you know how CBD affects you, I definitely think it's worth trying a very low dose and making sure that you are taking it at a time when you're home and don't have to drive anywhere or operate any heavy machinery. However, even high doses of up to 1,500 milligrams a day of CBD have been reportedly well tolerated. And for me, I generally don't recommend anything above about 150 milligrams a day. I think 200 milligrams a day is probably the ceiling of where I'd go. So you can tell that even up to 1,500 milligrams, which is really a huge amount, it's thought to be safe and well tolerated. That being said, of course, CBD does have the potential, like anything, to have some side effects. There's been reports of dry mouth, drowsiness, lightheadedness, nausea, diarrhea. I've definitely experienced some drowsiness. Usually I'm taking CBD at night, and that's kind of a beneficial effect I'm going for. But until you know how CBD affects you, definitely make sure that you are trying it at home in the evening and just a very low dose before you see how it affects you. And I'll go into some more specific dosage recommendations at the end here. But the other thing to keep in mind with CBD is that it can affect, particularly at high doses, it can affect levels of other medications. So if you're on a medication where it's really critical that it remain at a certain blood level, so like blood thinners, anti-seizure drugs, chemotherapy, antiretroviral drugs like for HIV, you want to make sure that you are keeping your doses low, so definitely below that 200 milligrams of CBD a day. And make sure to talk about it with your doctor or pharmacist before you start taking it to see if maybe you should get more frequent monitoring of your blood levels of your other medications. Now, it's really important to try and figure out how to find a medical grade CBD. And the key things to keep in mind when you're doing that is what's the actual source of the CBD. It's the same chemical, no matter where it comes from, but it actually does matter where it comes from because the other chemicals that come along with it make a difference as far as its medicinal effects. So I'll talk in a minute about the difference between CBD derived from marijuana versus CBD derived from hemp. The other thing to keep in mind is that method of extraction really matters. So let's say they're using CO2 extraction. That's considered a very clean method of extraction, meaning there's not a lot of residual solvents or toxins left in the product. There's some other methods like alcohol or other solvent extractions, which are thought to leave more residue. So you want to look for a clean extraction method. You want to make sure that the product has been tested for potency, pesticides, and purity. So potency is how strong is it, how much CBD is in it. Pesticides and purity really means, are there any residual solvents? So that's really key when you're looking at like, how do you find good quality CBD? And then when you're looking at effectiveness, there's products that have been isolated down so it's just CBD alone with no other chemicals that come from marijuana or hemp, versus full spectrum extracts, which also extract a lot of the other chemicals from marijuana or hemp. And that can include things like THC or other cannabinoids like CBC or CB1, some of the terpenes and other chemicals that are in marijuana and hemp. And some of those themselves do actually have some positive health benefits. And as I discussed earlier, there's also this concept of an entourage effect, whereas CBD on its own is not going to be as effective as CBD combined with other cannabinoids such as THC. So that's something to keep in mind when you're choosing a product as well. So what do dogs have to do with CBD? Well, the important thing to remember here is that just like dogs are one species, but there's many different breeds that have many different characteristics, cannabis is one species and it has two breeds. One breed is marijuana. It tends to be high in THC, low CBD, and it tends to be low in the fiber that's used for industrial purposes. Then the other breed is hemp, and industrial hemp has been bred to have a lot of that fiber that's used for industrial purposes. It's been bred to have very low THC. It has to have below 0.3% to qualify as hemp. And lately, for CBD extractions, industrial hemp is being grown and being bred for very high CBD levels. So there's a little difference between CBD from marijuana and hemp. Some of it is around effectiveness, some of it is around legality, access. So the basics, CBD from marijuana, the good news is when it's sold in a dispensary, a medical marijuana dispensary, you know because of state laws that it's going to be tested for contaminants and potency. The bad news is it tends to come from plants that have a higher level of THC, so it's harder to find an extract that contains little or no THC. It's also only available in states with legalized marijuana usage. CBD from hemp, however, is accessible and legal in all states. You know it's going to have low to zero THC. That's the good news. The bad news is there are no state or federal regulations that mandate testing at all. Anybody can put any product they want for sale online. They can say it contains CBD even though it contains none, and they can sell it to you. That's really scary, and that was scary for me as a physician when I was recommending CBD as something I wanted my patients to try. So you want to make sure that the product that you are taking is trustworthy and has been third-party tested to verify that it actually has the CBD in it that it says they have, and that it doesn't have anything else in it like pesticides or solvents. The other thing to keep in mind is that because hemp is a bioaccumulator, it's actually a plant that really sucks up chemicals from the soil it's grown in. It really has to be grown organically or it's going to become very easily contaminated with pesticides. So you want to make sure that any CBD extract from hemp that you're purchasing has been tested for pesticides. Now, interestingly, Journal of American Medical Association last year was worried the same way I was about what my patients might be getting when they bought CBD online. So for this study, they ordered over 80 different CBD products sold online, and they found that they were mislabeled over 50% of the time. Sometimes they were underlabeled, sometimes they were overlabeled, sometimes they had no CBD in them at all. And that's very similar to what I found when I did some testing on my own of different products that I purchased both in Portland and online. So guidelines for buying hemp CBD extracts online. First, do your research. Do your research on the company, make sure that you trust them, make sure that the information they're putting out there is reliable. You want to make sure that they're using organically grown hemp as much as possible, that it's been lab tested for the 3 Ps, purity, potency, and pesticides. Ideally, they would post testing results from a reputable lab on their website, in which they would not only test for potency, but also verify that there's no pesticides or contaminants left from the extraction process. And you want to make sure as much as possible they're using clean extraction techniques like CO2 extraction. Now, if you're using CBD medicinally, there's a couple different ways that you can use it. CBD is typically fat soluble, so it tends to be the most absorbable when you mix it in with an oil. So a really common way to see it is an oil-based tincture. And for that, sublingual is a very effective way to take it. You put it under your tongue, leave it there 30 to 90 seconds, swallow the rest. You get a whole bunch absorbed just under your tongue, and then the rest is absorbed through your GI tract. Or if you don't like the taste or the texture of the tincture, you can instead use a gel cap, which is just like a supplement, a pill, and that only goes through your GI tract, although you're not going to get as much absorption because a lot of it is sort of wasted as it goes through your GI tract. You still will get some, but you're not going to get as much CBD as you did from the sublingual tincture. And then more recently, there's been some movement to make products that are actually water soluble. So as you know, if you mix oil and water together, they don't mix real well. So CBD, because it's fat soluble, doesn't tend to mix well with water. So in order to make it water soluble, they have to do a lot of chemical alterations to the CBD. I personally am not a fan of the water soluble nano-emulsified CBD simply because of all those chemical alterations and all the things that have had to be added to it to make it water soluble. That being said, some people really like the water-soluble solutions, so those are reasonable too, and you just do them the same way, sublingual, under the tongue, 30 to 90 seconds. Again, I like full-spectrum extracts. I think they're the most effective. For dosages, you want to start low and go slow, particularly until you know how it affects you. You want to start with just maybe 5 milligrams, taking it once under the tongue. Start it in the evening in case it makes you sleepy. Then the next day, maybe try 7 milligrams, the next day 10 milligrams, and ultimately work your way up to the usual recommended dosage is around 15 to 30 milligrams up to 4 times daily. Now that can be taken scheduled, meaning you're taking it 4 times every day. That can be taken just as needed, for example, just for when you're feeling anxious or having a pain flare. I find for fibromyalgia, it tends to work better when you take it scheduled. You certainly don't have to take it up to 4 times a day. You could take it scheduled once in the morning, once in the evening, and then you could take an additional 1 or 2 doses just as needed. As long as you're not going above about that 120 to 150 milligram dosage of CBD, you can really experiment with what works the best for you. I hope this information on CBD has been helpful for you. As promised, I wanted to make sure I answered that most awkward question of all. Will CBD show up or affect the results of a urine drug screen? Well, the answer is it depends. And it depends on how much THC is in the product. So urine drug screens actually check for THC, not CBD. So if the product that you're using has absolutely 0 THC in it, and you're positive of that, and you can either third-party test it yourself, or you trust the results of any testing that the company you're buying it from has published, then as long as there's no THC in that product, it should not show up at all on a urine drug screen. However, as you know, a lot of the CBD products out there do contain microscopic or trace amounts of THC. And in fact, those tend to be the ones that, in my experience, work the best. So in that case, then it's a matter of dosage. If you are taking a lot of that CBD, it's possible that over time, enough THC could build up in your system that you might test positive on a urine drug screen. Now, in my experience, it takes a lot to do that, but if a urine drug screen is important for, keeping your job or things like that, you really want to make sure that you're seeking a CBD that has 0 THC. That being said, for the most part, the microscopic amounts of THC in most CBD products are not enough to, in normal dosages, show up in a urine drug screen.